I missed to welcome Miss Priya. She has joined our group today. And I mean, she didn't switch on the video and I didn't realize that she has already joined. Priya, can I request you to have your camera on? Oh.
Yes, ma'am.
So you should have had your camera on. See, if you're not visible, then you're not, noticed by anybody.
Yes, yes, ma'am.
Please keep your camera on. Are you comfortable having your camera on?
Because today I am not feeling well. That is why I switch my camera.
You will feel better if you will sit and participate.
Yes.
I request you to. Yeah. Okay. So all of you had a partner. I think except Mr. Vimal, everybody had a partner. Am I right?
Yes, ma'am.
So
Yes.
how do you how do you feel
Um,
about the interaction that you had with your partner? Has something changed? If anybody would like to share their experience, maybe one or two people can share their experience.
Yes, ma'am. We
Okay.
got a yes,
Yes.
ma'am. We got a new person introduction, like where he's working, like
Mhm.
what are the departments he's taking care of,
Mhm.
and then it's the same department, same the operations, so that we'll also get to know that any extra we can learn from him, like any extra things he's doing,
Wonderful. Wonderful.
like that.
Thank you. Thank you. Dr. Malik, I think you wish to add to the discussion. Go ahead, please.
Yeah. In the last session, when Dr. Nirankar was introducing himself, I felt he was a very serious person. But today, in that 1 minute interaction, I found he's very more friendly and welcoming person.
Exactly. Wonderful. I think that's a very, very interesting, observation, which I'm going to bring in a minute. Thank you. Yes, Dr. Santosh, please go ahead. Share your.
So though we had the on day one we had introduction but still it was like that one of the 21 people in the group, but now we had personal rapport building kind of thing. So we know more about the person, though we spent only 3 minutes time. So probably I could know her, more, and probably this is a personal relationship which we have got now.
Excellent. Wonderful. Thank you. Yes, Dr. Purnima, please go ahead.
Madam, I was fortunate to be in a room with Dr. Shubhra Bajaj, and I was very much blown away that she has holding such diverse qualifications, PhD in English, as well as she's a nutritionist, and she's contributing to both fields, as well as very nicely holding such a good post of associate professor in the National Institute of Technology. So it goes to show that there are no boundaries, and one can perform very well in different fields and sectors and still be open to learning. So it was very illuminating and inspiring. Thank
Oh
you.
my goodness! In 3 minutes, you could get so much. I'm surprised.
So much. Thank you, ma'am.
A lot. So again, it depends on, are you listening? Are you showing interest? Are you encouraging the other person to talk? Is the other person finding you as somebody who is listening with interest? See, I think you demonstrated that very well. I think Shubhra must have been surprised at knowing, oh my goodness, she has noticed so many things in my discussion. So that's the way you. Yeah. Yes, Shubhra, go ahead. You want to add something, please.
Ma'am, it was like in the first introduction, the very first session, like she's very senior to me, and it was like a strange, unseen distance between us. So when you're in a meeting room in a one-to-one interaction, you come to know such a impressive profile she holds, and yet she's so humble, and she's a very good communicator. So it was nice to be in a one-to-one meeting room. Obviously, it closes down the gap, and it brings out so much about a person that we don't usually infer in a group interaction.
Wow. And imagine how much time it took. 3 minutes.
3 minutes, yeah.
3 minutes. And you could really connect with each other. Yes, Dr. Manjusha, you wish to add something. Go ahead, please.
Just that I was fortunate to be with Dr. Kausar, and we found a common platform. That is one thing. The second thing is, I think, madam, we should do this very often. Each one in this group.
There will be lot of activities. You will, you will get to engage with your partners, and you will actually forget that we are on an online platform. You will feel as though we are in the same classroom physically together. And that's what is the beauty of this program, that you will really enjoy every bit of it, and every activity has a message. I'm going to talk about the message in a while. Yes, Kausar, I think you wish to say something in that, Dr. Deepak.
Yes, ma'am. From the first day one, somebody just picked me up randomly. I thought I made one friend, and today I guess I made another friend. So it's very nice to be able to bond with everybody. I think I feel very privileged to be able to get to know her one on one in such a short span. So I'm very thankful once again. Also, I believe through a course of 10 days, I'll get to know everybody else as well. Yes. Thank
It's a
you.
long-term association, don't worry. We are going to work together for very long. Yes, Dr. Deepak, go ahead, please.
Yeah, for me, Anju Bhatia was my partner in the room, and I felt she was very friendly. She was talking so openly. I felt so lighthearted, and I'm so happy that she's considering her profession as a very noble profession. And I welcome Anju to Kochi because she said she wanted to come to Kerala.
Wow. So you have friends in everywhere across the country where you can visit each other. Thank you, Deepa. I think that was a very kind gesture, showed by you. Yes, Suvira, go ahead, please. Yeah.
I was fortunate to have Aarti as my partner, and we both were two smiling girls across the screen, and we shared connection and vulnerability in no time. And from what I can see from everybody's smiles, is that this activity deeply resonated with each one of us, and it helped build connection and generally strengthened all of our bonds with each other. So it was really nice to connect with somebody one on one.
Wonderful. Thank you, Subira. I think that was a nice explanation of your inner, experience. So, two things that I want you to pick from this activity. One is when patients come to us, see, we are familiar with every nook and corner of the hospital and our place. But when they come to us, the whole thing is very new. They are in pain, they are suffering, they are under some condition, and the hospital environment is sometimes very overwhelming for the patients. The smell, the machinery that we don't even notice, it becomes too much for them to actually handle. So at that point of time, if somebody, proactively expresses a gesture where they show that, yes, I want to talk to you, I want to listen to you, I'm there to help you, it really relieves them of, that anxiety that who will talk to me, who will listen to me, who will. So building rapport is not the doctor's responsibility alone or the nurse's responsibility. This skill we have to teach to everyone who comes in contact with the patient. So patient will be first coming probably to the parking lot, then to the security guard, then to the first front desk, and then to the.
I need to. I'm at work.
Anju, can you mute your device, Anju? Yeah. So the idea is we have to look at it from the patient's point of view. If patients get the same kind of response from everyone, that everybody is very polite, nice, proactive, ready to help, imagine the impression the patient is going to go back with. That's one message I want to give. So we need to train everybody who comes in contact with the patient to make sure that they first build rapport before they start actually doing the interaction with the patient. Second message that I want to give you through this activity. See, we spend most precious hours of our life at workplace. I always say people that your workplace is like your second home. There's one home at home, there are family members at home. This is your second home, and people you are working with is like your second family. It's so important to create an environment where everybody feels connected with each other. The kind of support you can get from each other just by knowing each other, becoming familiar, becoming comfortable. Imagine how good the whole environment will be. For example, if all of you were from the same hospital and you interacted on this platform, after the activity, now if you had something to take help from a particular department, for example, radiology or pharmacy or from lab, you could just pick your phone and call that person and ask for help. And that person could right away would be willing to, give you all the help that you want. So same way we have to create that kind of environment because patient care cannot be done in isolation. For every patient, we require participation of so many departments. So it's very important to have rapport with all the departments from where we can get help to make sure that we are able to give best to the patient. So two messages from this activity: it does not take time, it's proactive approach, and it is beneficial to both the parties. And the point Dr. Malik brought in was that I thought that Dr. Nirankar is a serious person. I'm sure many of us had similar, thought processes, or uh, thinking about each other. Oh, this person looks very serious, or this person looks snobbish, this person is not very communicative. But when you communicate, you realize, oh my goodness, they are as normal as I am. They are as fine as I am. And that's very, very important. So make sure in your workplace, you build rapport with every team member, because everybody plays a role. Right from your security guard, housekeeping, technicians, nursing staff, doctors, residents, administrative staff, billing staff, people working in the kitchen, everybody plays a role. And we need to make sure that we are connected with everyone. So this is one skill, and it's a huge help to make your task easy. Try doing this with your security guard. Smile and say, hello, how are you? How was your day? Next day, he will salute you and he will smile and he'll say, Kaise hai, Sarah?
And he will tell all the information in the hospital. 1 year.
So that's good or bad?
It's a good, man. It's good.
It's
It's
definitely.
like they don't have the fear to tell us what's
Yeah.
going wrong in the hospital. And
Otherwise,
they'll become the
otherwise,
they'll become the whistleblowers, like
yes.
where is gets going wrong.
They are
Again.
eyes and ears of the hospital. We should really have good rapport with them.
Yes, ma'am.
So I think this activity did help you to understand how building rapport is important, and how easy it is to build rapport, and how beneficial it is to build rapport. Now, my next question to you is, what interferes with building rapport?
Ego?
Okay, that's one good reason.
Cultural difference?
Okay, cultural difference. Yes. Parvi, you want to say something, Kiti?
Perception.
Yes.
Let Parvi finish. Yeah, Parvi, go ahead.
Yeah, ma'am, I would like to say that interference cannot be only from the person who is speaking, but also from the person who is listening, both ways. And one is which I've noticed because I'm myself neurodivergent. So, neurodivergence as a trait can actually be an interference in verbal communication where, I experience easy distractibility. So, people like me, for us, verbal communication is a little bit difficult. Written is preferable.
I think that's a very important point you have raised, Parvi. So when we communicate with different populations, so in this book I have talked about people, different population that we interact with, and I think one of them is where the patient has some different ability and some different challenges. How do you really build connection with them, and how do you really communicate with them? But you have brought in your own personal experience, so I think that makes it all the more clear that how important it is to understand. Somebody might think that, oh, you're not communicative, not realizing that you have challenge communicating verbally, but otherwise you are very communicative. Maybe your mode of communication could be very different from the usual one, and I completely agree. Yes, Anju, I think Dr. Santosh brought a point, and then Anju, then you can come in.
So
Yes.
preoccupation and the perception we have.
Yes. So a lot of time we perceive what we have here, what mind do not know, eyes don't see. So your inner perception really can distort your communication. I completely agree. Yes, Anju, you wanted to say something. Go ahead.
Language barrier. If the other person is not able to understand your language.
Absolutely.
So like I am in US and I don't know Spanish.
Mm.
So it's sometimes very difficult and we have to use a transcriber to convey. But that also does not help too much because unless you are able to make a direct communication and connection with the patient, there is still a language barrier.
Absolutely. I think Anju, you are very right. How many official languages do we have in India? Any idea? 22. And how many dialects? More than 1,000. And imagine the challenge communicating with people. So language can be a huge barrier. And especially in India, I'm sure all of you know India is going to be the next medical tourism hub. We are already actually into it, but very soon we can expect a lot of patients coming from the neighboring countries. All the more important that we understand their language, they understand our language, and we are able to communicate. Language can be a huge barrier. There is no doubt about it. And we really need to, find ways to communicate with the patient. I'm going to talk about language a little more. Yes, Dr. Manjusha, you have a point to add. Go ahead.
Madam, I don't know if I'm right, but social anxiety, even though we are doctors and healthcare workers, there are two aspects. One, anxiety in communicating. Second, the feeling that you might let yourself out, the cat out of the bag, if you really, start interacting with patients. The fear of actually forming maybe the transference or counter-transference.
So maybe somewhere we are not very sure where to draw the line, and for that reason we kind of close ourselves, and we have a kind of image or a picture that we are non-communicative, whereas actually, I mean, you can communicate and still maintain the professional distance with your clients, which is very important. There's no doubt about it. But because we have not learned it, somebody has never discussed about it, so we prefer to stay quiet and kind of non-communicative, especially being informal. We avoid being informal with the patient and with our fellow professionals. So Veera, you have a point to add. Go ahead, please. Yeah.
Speaking from personal experience, ma'am, in terms of non-verbal communication, I feel that the lack of facial expressions sort of scares me, because I feel कि oh मैं सही तो बोल रही हूँ ना, कि मैं कुछ गड़बड़ बोल रही हूँ, like why are there question marks on other people's faces? So that naturally puts me into this space कि okay, let me just become quiet अभी मैं कुछ नहीं बोलती हूँ, okay, no problem, and then I shrink in size. So that it becomes a very I
Because the
think that's
feedback you are
somewhere.
getting is very confusing. You're
Yeah,
not getting
yeah,
feedback, and that means the body language of the other person plays a very
yeah,
big role in continuing the conversation.
yeah,
So I'll come to that. That's a very important part we are going to cover in a minute. But before that, as we said, language is a very big barrier. I want to do a small activity to tell you how our language can actually be a huge barrier. So all of you, set your hands free. Have your cameras on. Have your cameras on. Everyone, please have your cameras on. Please come in. Yes, yes, yes. Thank you. Thank you. आनंद जी, अगर आप कैमरा ऑन नहीं रखेंगे तो मुझे नहीं पता आप यहाँ पर हैं. So it's your loss. Of course, it's my loss also. But then it's your loss because मुझे नहीं पता आप हैं या नहीं हैं. So please try to keep your camera on. I know some of you may find this session very basic, but look at this session from two points of view. I am going to talk about very simple things which sometimes we think we know, but we don't practice. And second, when you have to transfer these skills to your participants, if you will teach theory, nobody will listen to you. But when will you do activities and these things, they will immediately connect with you and pick the point, and they will start showing those skills with you. So set your hands free, and I hope you remember that poem. If you're happy and touch your nose. कर सकते हैं? So I'm taking you to your childhood. ठीक है? अपने घर के सब लोगों को बोलो बाहर हो जाए, हम अपने बचपन में जा रहे हैं. Okay. So you have to do it with me. Okay? Everybody is ready? Okay. If you are happy and touch your nose. If you are happy and touch your ear. मेरे साथ करना है भाई. You can't wait for me to finish. You have to do with me. वेट नहीं कर सकते, फिर एक्टिविटी का मजा नहीं आएगा. ओके, नाउ वी आर डूइंग इट एक्चुअली. वो प्रैक्टिस सेशन था, अब रियल वाला है. ठीक है? इफ यू आर हैप्पी एंड टच योर नोज. इफ यू आर हैप्पी एंड टच योर ईयर. हाउ मेनी ऑफ यू वर अबाउट टू टच योर चिन? रेज योर हैंड. अंजू ने सिर्फ कान पकड़े, बाकी लोगों ने, दीपा ने भी कान पकड़े, बाकी सब लोगों ने.
I first touched my chin, then I realized his ear, so I touched his ear.
Because
Same here, ma'am. Same here.
yeah, because see, your body language plays a huge role. Huge role. 55% of the communication happens through your body language. So we have to be very mindful of the body language. Words, of course, play a big role. I'm going to do another activity on language, but body language plays a very big role, and I'm going to show you how. But I think this activity does tell you, you may tell to your patient, no, 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 I'm not angry, I am okay, I'm fine. Or to your staff, you may say, I'm not a angry person, but your body language is not matching with your words. So they are observing your language, body language, than your language. Now, coming back to the language part, again, as I said, language plays a very big role, and unknowingly we use certain things which we don't realize, and how they can be detrimental, not only to build rapport, but to have a conversation with the person. So I need total 5 people, and I want rest of you to switch off your camera. Any 5? So जो लास्ट में 5 रह जाएंगे, पहले बंद कर लीजिए जिसको नहीं करना एक्टिविटी. बट आई वांट 5 पीपल. जिसका कैमरा ऑन रहेगा वो बंद नहीं कर सकते. 5. कितने रह गए? 3 4 5. एक और बंद करना चाहे तो कर सकते हैं, नहीं तो वी कैन डू द एक्टिविटी. ओके. So all of us, like we are now seven of us. So अपना अपना वो अनम्यूट कर सकते हैं डिवाइस, बिकॉज दिस इज वेयर यू विल हैव टू डू द टॉकिंग. मिस्टर विमल, आप भी अपना डिवाइस अनम्यूट कर लीजिए if there is no sound around you. Okay. So imagine that all of us are going for a picnic and we are having a discussion about the plan. I will start the discussion and everybody will start in the same manner. I'm okay with the plan of picnic, but then after but, each one of you will have to give your own reason that why you cannot go. For example, I'm okay with the plan of picnic, but I have some guests coming home. Dr. Manjusha.
I'm okay with the plan of picnic, but I have an assignment due tomorrow morning.
Okay. Dr. Santosh.
I'm okay with the plan of picnic, but I'm not feeling well today. Right.
Okay. Dr. Nirankar.
I'm okay for the plan of picnic, but tomorrow I'm scheduled with my some consultation to be done.
Okay. Dr. Satya.
I'm okay with the plan of picnic, but it would be better if I know the activities that would be part of it.
Okay. Dr. Jacob.
Yeah, I'm okay with the plan of picnic, but I would be traveling and going out of station tomorrow.
Okay. So do you think we will be able to go to picnic?
No.
Okay. Let's have second round of discussion and let's replace this word but. Instead of but, we will say and. I will start the discussion and we will go in the same order. I'm okay with the plan of picnic and I will get food for everyone. Dr. Manjusha.
I'm okay with the plan of picnic and I'll arrange all the games.
Okay, thank you. Dr. Santosh.
I'm okay with the plan of the picnic, and I have one of my friends. I'll ask him where we can stay and what activities we can do.
Oh, very good. Thank you so much. Yes. Yes.
I'm okay with the plan of picnic, and the place where we are going, I know few people, so we can have local activities over there.
Oh, very good. Thank you so much. Thank you. Yes, Dr. Satya.
I'm okay with the plan of picnic, and I can arrange the travel for all of us to the place.
Okay. Thank you. Thank you. Yes, Dr. Matthews.
Yeah, I'm okay with the plan of picnic, and I would, actively see that there are a lot of activities for our picnic.
Excellent. So I think everything is done. Food is looked after, travel is looked after, activities are looked after. I mean, I think we are really going to have fun. Everybody's ready to go?
Yes.
Okay.
Yes.
So can I ask everyone to come in? So what did you observe?
It started with a positive whatever you started, ma'am, it continued with the same thing. Like you started, I'm ready, I'm okay, but I'm not. So it's continued with that, except one person who said there is a possibility. Otherwise, rest all continued same.
I just changed one word, and the whole interaction changed. We need to check the kind of words that we use in our day-to-day interaction with our team, with patients and their family members, which could actually be detrimental, which could actually be harmful. So can you think of some words that you say, or you have seen people saying or heard people saying, and you think they are not appropriate? It could be with the patient, it could be with their family member, or it could be with your staff member, with your team member.
Straight away,
Like
people
that.
generally start with it, no. Any suggestion, and then people say sometimes giving excuse always or say no.
No. सीधा सीधा ही ना, पूरी बात नहीं सुनी, but no, sorry,
हाँ.
नहीं हो पाएगा, I can't do it. Very right, very common. What else?
Irrelevant answers.
Sorry?
Irrelevant answers.
Until?
Irrelevant answers, madam.
Irrelevant answers that are not relevant, irrelevant answers. Okay, yes.
That is not suitable to the situation.
Sorry?
That is not suitable for the question.
Not suitable to this. Kausar, you want to add something to it?
Ma'am, something very simple. Just like how I said, in first instant, people say, no, I cannot perform this job. Second instant, a domino, it would be better if they say, I will think about it, or let me come back to you. Maybe they can do it.
So rather than saying no, we can wait and answer. Yeah.
Yes.
Parvi. Yes, Parvi, go ahead.
Yeah, so I've noticed that in healthcare industry, a lot of people use extreme diplomacy so that the patient doesn't get a shock about their condition, health condition. But I feel that empathy and honesty should be balanced in order to deliver accurate information
I
with
was
a little bit
asking
of
for the words that we use that are not appropriate. My question is maybe. Let me see. We know we don't want to say no clearly, but we'll say, let me see. I'll come back.
Yeah.
Or
Yeah.
sometimes when it's very rude and aggressive, we straight away say, don't you know this much? Have you done your program? Where have you done your program for? Sometimes consultants would talk like this with their juniors. Where did you do your medicine? So, I mean, being aggressive with them. Yeah. So any point, Dr. Manjusha, you wish to add to this?
Impossible. One word always admits.
Absolutely. For Suvira?
Specific to grievances, I am sorry, but something.
Yeah.
You know, so
give
then
a
how is
And
that an apology?
another thing I want to highlight is that you are wrong. Saying somebody or something that you are wrong. So the correct way of saying it is that maybe, but I think we can talk a little more about this or get into the details like this.
I agree. So we are left with 35 minutes and there's a lot of content to be covered. I'm going to now cut short the question answer session because I want to cover all 5 skills. I'm taking you through the presentation, and of course there will be questions in between and discussion around it, but we will quickly try to make sure that we are able to cover the planned content in today's session and we don't miss anything very important from the discussion. Give me 1 second to okay, there we go. Couple of slides we have already covered, so I'm not going to show you them now, but just to make sure that we don't miss anything important. We have talked about all this activity we have done. Yeah. So this is like, now please be mindful of your language, especially with your team members, your nurses, your technicians, your other support staff, because we at times assume that we can behave the way we like. But please remember, they are the one who are your support system, and they are the one who are, going to help you in everything that you are doing. And with them, if you are rude and disrespectful, it's not a very good idea, because ultimately, if somebody is not happy working with you, they will not give their 200% to you. And that can be a big, issue with you. So talking about language, I think this one line I want all of you to read for yourself. I hope you agree with this. So I think even if you don't understand your patient's language, but they can definitely see if you're kind and helpful and forthcoming, and they'll be happy even with that, gesture. Other than language, second part which plays a big role in building rapport, or actually, interfering with building rapport, is your tone of voice. 38% of the communication happens through your tone of voice. If you read this one sentence that I've written 6 times with little emphasis on the word that I have underlined, I think you will be able to understand my message. And you will see every time the message will be different. Do you agree with me? Okay.
Yes, ma'am.
Yeah. So anytime in public dealing, especially with patients and their family member, if you sound unfriendly or you are disinterested, inconfident, rude or authoritative or aggressive, that's not something your patients are going to like. And that can actually trigger extreme reaction. The correct way to interact with in public dealing, especially, you have to sound friendly and responsible, confident. And confidence comes from knowing your place, knowing your department, knowing your subject, knowing your patient. And it's important for all of us to know how our hospital functions. At the same time, we need to be soft and polite and professional in our. So, as I said, inappropriate tone of voice can actually trigger extreme reaction. People don't get angry on words. From the tone of voice, they can sense that you are being rude with them. For example, somebody comes in and I say, Aye. Somebody comes in and I say, Aye. So can you see the difference between the way I said for the second time? I mean, anybody can guess that I was being rude and aggressive with the person. So we don't sometimes go wrong on words, but definitely we fail on tone of voice. Third thing, which I was talking about, body language, and I'm sure you can make out from this picture what this person is trying to say. Very angry, very annoyed, very unhappy. That's because we don't need words, but from the body language we can make out. Especially when we talk about body language, all these things come in your, under the aspects of body language, your facial expression, eye contact, gesture, posture, touch, and even the space that we maintain with the patient. For example, usually what are our facial expressions? What are our facial expressions? 1, 2, 3, 4, 5. Any guess? Number?
1.
Number 5. Am I right?
9.
Dr. Manjusha, subah 9 baje, and then if the patient is nice. But later during the day, and when the patient is not really very nice, our facial expressions usually are number 5. And that is no expression. Why do we keep that expression? Because we don't want to connect with the patient. We fear that if we will be, friendly, the patient might take advantage and may try for secondary gains. But please remember, nobody likes to interact with the person with this expression. Smile can actually change the value. It's very important to smile, and it also is good for our own mental health. So if you have facial expressions like anger, irritability, unhappiness, trust me, they are visible. Whether you like or not, whether you want or not, people can make out that you are angry or you are frustrated or you are unhappy. So it's very important to be mindful of our facial expression. Similarly, we should be able to read other person's facial expressions. It's not just be mindful of your expression, but you should be able to read others' expressions also and accordingly fine-tune your interaction with them. Next is eye contact. Why is it important to make eye contact? Is it important to make eye contact?
Yes.
Why is it important?
So that we give a signal that we are interested. in communication.
Eye contact actually shows that yes, I'm listening to you, I'm giving you attention. At the same time, I think when you make eye contact with the person, you're able to observe a lot of non-verbal cues, which you don't get otherwise, on verbal communication. So the protocol is when you are interacting with people, especially at a workplace, it's good to look on, at the eyes and above the eyes. In personal relationship, we can look at the eyes and below the eyes, but in professional relationship, we should look at the eyes and then above the eyes. And the glance should not be more than for 2 to 3 seconds at a stretch. If you look, longer, then it appears more like staring at the person. It could be taken as being challenged or being refuted. And let's not look at the person from head to toe, because person might feel uncomfortable. Posture. In this, there are two postures, A and B, which is okay. A or B? Which is okay?
B, ma'am.
A.
B?
It's a closed posture.
Actually, both are not
A.
okay. In A, the person is very callous. In B, the person is very closed. So both are not okay. So we have to be mindful of our posture. Sometimes verbally we don't say anything, but our posture says that we are not interested or we are not listening. So when we want to build quick rapport with the person, I think the most important thing is to pay prompt attention. If somebody comes talking to us or interacting with us, first thing, even if we are doing something very important, we can just make eye contact and say, just 1 second, let me finish this. Even that's enough. But giving them attention is very, very important. Greeting, of course, normally they would greet, but if they don't, we can always greet and welcome them. Smile if it is appropriate. Unless it is something very serious, it's a good idea to smile. Offer place to sit, especially if the patient has come for consultation or for a little longer discussion. It's important to make them comfortable. Introduce yourself. Why is it important to introduce yourself? Why is it important to introduce?
And for the identity, they might be looking for one doctor and end up in another place.
So a lot of time, when I go to the hospital, some people are wearing green color uniform, some are wearing blue, some are wearing violet color. So they know the difference between each color. But the outsider or the new person will not know whom I am interacting with. And unless you have a proper, name tag with proper designation. So it's always a good idea to tell your name and your designation, what you do or what is your role. And then ask for patient's introduction. Why is it important to take patient introduction? An old lady with a young boy is coming to your clinic. Who is the patient?
We do not.
Who is the
Mother,
patient?
mother or
Could be the
grandmother.
grandparent.
How do we know? How do we?
Cannot exactly know. This is a supposition actually.
That's what I'm telling. So we are not supposed to assume, we are supposed to ask. We are supposed to ask who is the patient. Lot of time names like Neeraj, Vijay, or Goldie, they are common for both girls and boys. So we might assume, Goldie means boy. Goldie could be the name of the lady also. So it's always good to ask who is the patient. Then ask for attendance introduction. Why is it important to ask for attendance introduction?
To know more about exact what the problem is.
Again, there's a possibility that this person is related or not related to the patient. And how do you ask?
Whether to share the specific information before the relative or not.
Very important. So when a young girl with a boy comes with a young boy, so what is the assumption? They could be friends, they could be brother, sister, they could be husband, wife, they could actually be colleagues. So it's always a good idea to ask for attendance introduction. So what is the right way of asking? Are you her friend? Are you her brother? Yes?
May I know how you're related to Mrs.
Please let me know what is your relationship with the patient. How are you related to the patient? Are you her husband? No, I'm her colleague. So that's not appropriate. And then, of course, small talk before the big talk. This is very important. What is small talk before the big talk?
Hello, hello. Pleasantries.
Simple things, something like, did you have difficulty locating my office? Or did you have to wait a lot to be with me? So how does this small talk help you?
Rapport building.
One is rapport building, excellent. Then
We can get to know the patient mood of like how he's cool or is very rigid to some questions.
okay, that's also correct.
Making
And
more comfortable.
sorry, making them comfortable. Okay, that's also a good idea. See, when you do a small talk, when you ask a couple of questions and the patient answers, lot of things you can actually. One is patient's language, what language patients speak. Then, does patient have some hearing issues? Does patient have some comprehension issues? Does patient have some speech issues? So many things you can get to know when you do a little bit of small talk before you actually get into the direct interaction. And then when they are talking, it's important to demonstrate interest and respect. So this is little bit about building rapport, and this has to be done very mindfully. See, if you look at the points I've shared here, it will not take very long. It's just a matter of a minute, but it will open a gateway to a long-term relationship with the patient. Patient start feeling comfortable and okay with you the moment you show these gestures and interaction with the patient. The second skill that I want to recommend to all of you is attentive listening. I think right from the beginning of the session, all of you talked about attentive listening, and uh, we all know and we think that we really listen very attentively. So I'm going to show you, uh, you know, yeah, this is a questionnaire. So with the raise of your hand, but the thing is, I will not be able to see everybody. So I want you, all of you, to just maybe note down the number of ticks that you have on each. So the first is, how many of you say yes to it? You have to put a tick in your notebook. I interrupt often or try to finish the other person's sentence. So if it is yes, then maybe you can put one tick mark for it. I jump to conclusions. I am often overly parental and answer with advice even when not requested. I hope you are counting the number of ticks for you. Yes? Yes or no? Okay. I make up my mind before I have all the information. I'm a compulsive note taker. I don't give any response afterwards, even if I say I will. I am impatient. I lose my temper when hearing things I don't agree with. I try to change the subject to something that relates to my own experiences. And I think more about my reply while the other person is speaking than what he or she is saying. Count the number of ticks and write in the chat box. So total there were 10 questions. I want to see how many tick marks we have counted. Okay. Four. Wow. Dr. Manjusha. See, those who have got 3, 4, 5, that should tell you that you have actually analyzed yourself very closely. We have a tendency to overestimate ourselves. But if you have agreed that, yes, like Dr. Malik has said, 5. So honestly, it's very closely observing your behavior. You have mentioned 3, 4, 2. Again, Rose has also said 5. Good. So that means I'll share this questionnaire in the group if you want, and try improving on these things, because these are the things that interfere with attentive listening. So it is not only important to listen attentively, but it is equally important to demonstrate that I'm listening. So can you tell me, how do we demonstrate that I'm listening? Can somebody tell me? How do I demonstrate?
Madam, firstly, we have to lean forwards towards the speaker,
Okay.
showing that I'm actively interested in your talk, number one. Number
Okay.
two is that we have to nod our head.
Dr. Satya, let others also answer. Hold. You have to give, I have 23 people to who,
Asking question, maybe.
asking question. Very good. Then,
Facilitating, ma'am.
okay, facilitating. Very good. That's a very important point. Yeah. Anju Bhatia has written making eye contact. Okay, very nice. What else?
Repeating what
Responding.
they have said. Repeating what they have said.
Very right. Repeating. That shows that yes, I've heard you. And in case if I'm not correct, please correct me. Very good. I think that's a very valid point. What more?
Responding, yes, no.
Responding. That means even nodding or verbally also, yes, I am getting it. Yeah. Make them feel comfortable. So
Yeah,
how?
could be showing interest as well.
Sorry?
Showing interest to their
Showing
talk.
interest. That means making eye contact, facing the person, looking at the person, nodding. Very right, Rose. Very correct. What else? Like Suvira was mentioning here, if I get an expression that either what I'm saying is not making sense or what I'm saying the other person is not agreeing. So that means facial expression should show, yes, I'm listening, I'm agreeing, I'm understanding. So that's very important communication to do with the patient. And if you continuously just keep looking at the patient without an expression, they are going to get confused. Yes, Suvira, you want to say something? Go ahead. Yeah.
Yeah, like also not rushing the person in front of you, like letting them take their time, not being following some personal agenda of your own, which interrupts with the communication.
Absolutely. So again here, open-ended questioning. Did we discuss this last time? And open-ended questioning is a very good way to get maximum information from the other person. There you will not have to run after the patient or the person, and you will get a lot of information. So, and most important thing is please face the person, especially if you have computer or PC or iPad in your room when you're interacting with the patient. And if you are interacting more with the PC and not with the patient, again, patient will not, be satisfied with the interaction. If you remember the first video, everybody thought that the doctor was actually going through some personal file. It could have been the patient's file actually. But how would the patient know? Either you need to tell that I am going through your documents, or in between you will have to make eye contact so that the person knows that you are working, you are typing something simultaneously, especially when you are adding some information on the computer. Tell the patient, I'm feeding your information simultaneously so that I don't miss anything important. And then you can have the conversation. But in between, you will have to stop and listen to the person. And especially if they're talking about something very serious or something very sensitive, at that moment, if you are just keeping your hands on the laptop and working, it doesn't show, like Dr. Malik was saying, that you have to show that I'm interested in listening. And for that, you'll have to put things on hold and then listen. So multitasking is not a good idea when you are interacting with it. And avoid distractions. Very true. A lot of time we start looking at the phone, or we start doing something else, or we start interacting with the other person. That's absolutely not a good idea. That does not leave the person satisfied. So listening is a very, very important skill, and there cannot be more uncomfortable situation. There's no greater agony than bearing an untold story inside you. When a person comes to tell a story and you don't listen to that, because patients come with complete information they want to share with you. And do you know how quickly we interrupt the patient? Within few seconds. And that leads to a lot of dissatisfaction. So giving that 1 minute to the patient, Savira, you checked with me about that patient-centered communication. So if you give those 10, 15, 30 seconds to the patient for asking question and answering their question, they go back very, very satisfied. And also, if you allow them to talk, they are able to tell about their problem within 60 to 80 seconds. But that gives them a lot of satisfaction that they have been. So listening attentively is the second skill, but it comes with a lot of practice. Especially, we have a tendency to ask questions in between. So when patient is sharing information and there is something that you want to clarify, you can make a note of it, let the person complete, and then you can ask that you mentioned about this condition. Can you tell me more about it? And then let the person tell, rather than interrupting the person in between. And then person might forget what the person has to ask or say. That's the whole. So this is about attentive listening. The third skill that I want to recommend to all of you is positive and helpful attitude. I think being in healthcare, it is very important to have that attitude towards our work, towards our patients. Patients come with the expectation that we will be able to relieve their suffering and we will be helpful to them. So a lot of time you must have noticed that staff, they do their work the way normally they do it, but they don't showcase that positive and helpful attitude. So I want to just talk about it with a very interesting story. Maybe some of you may have heard this story. So there was a building being made, and uh, somebody was going through that place. He stopped and he asked one of the laborer, "What are you doing?" So this person says, "I am, breaking stones and I am earning my livelihood, and this is my source of income." So honestly, I mean, if you're working for money, there's nothing wrong in it because everybody works for livelihood. But if we are working only for money, then I think it's something that we need to reconsider because in healthcare, we can't work just for money. He goes to the second person and he asks the same question, what are you doing? And this person is little irritated and in a rude tone, he says, are you blind? Can't you see I'm breaking stones? So a lot of us, when we are working with patients or when we are at our workplace, we feel burdened and we don't enjoy our work and then we throw our weight on others and we are rude and aggressive to people. In a way, we are unhelpful. We are not really sending people satisfied with our actions. And I'm sure you must have seen a lot of people with this kind of attitude. He goes to the third person and he asks the same question. And he says, he takes him to one side and there's a map on the notice board. He shows that map and says, and there's a beautiful temple coming up here, and I'm constructing that temple. Three people doing the same task, but with three different mindsets. And each mindset brings the result that you hold. If you take your work as just a way to earn, then you will get money, but you will not really enjoy the satisfaction that you can get from your work. If you're unhappy, if you're not enjoying your work, if you're unkind, if you're not helpful to people, not only you will make your life difficult, but you will make others' life also. And if you really are happy doing what you're doing, not only you will get your, money you're earning that you get from it, but you actually get a lot of job satisfaction. Very honestly, I tell people who are working in healthcare that you need not go to any mandir, masjid, gurdwara, or church. If you send your patients happy and satisfied, they would actually give you a lot of blessings right at your workplace. You don't need to go anywhere. So I was taking a session for a group of doctors working in emergency medicine. In a very casual way, I asked, what do your patients normally tell when they are, leaving, they're going? So one of them said, sometimes they say, आपके साथ भी ऐसा हो तो आपको पता लगे. If my patients are saying something like this to me, I really need to stop and think what's wrong with my behavior that my patient is literally cursing me. अगर दुआ लगती है तो बद्दुआ भी लगती है, right? So we really need to be mindful of our the way, the attitude that we have. It's very important to have a positive and helpful attitude. And if you are helpful, automatically the fourth skill will come in place, and that is empathy. Empathy. So we experience four kind of emotions at workplace. For example, I'm in emergency department doing my work. A patient comes in. I can see the patient is in pain, is sitting right in front of me, but I continue doing what I am doing. I'm not sensitive to the patient's pain and suffering. This is apathy, lack of sensitivity, which is absolutely not appropriate. Now, this patient's attendant comes and fights with me, like starts shouting at me and says, "What is this, madam? I'm here for the last half an hour and nobody's attending to me. What is the point of bringing the patient to the emergency if you are not even promptly attending?" Now, this person has insulted me in front of so many people, and I'm very upset about it. In the heart of my heart, I say, "I'll make you wait for another 10 minutes." That is antipathy. A lady comes with a child is crying, mother is crying. Seeing them cry, I start crying. That is sympathy. All these three emotional responses are absolutely not desired. The important and essential response is empathy, where I can look at situations from their point of view. Had it been my family member, what would have I felt? Or what would have I expected? So when you start practicing empathy, you actually are able to see their world. You are not annoyed with them. You don't judge them. You're just being helpful to them. So I want to show you a small video on empathy. Maybe some of you have seen this, but I really find this video very touching, and it really conveys the message very clearly. And let's watch the video and then hold the discussion. I hope the screen is visible to all.
Yes, ma'am.
Yes, ma'am.
Ma'am, there is no voice, ma'am.
This is the video produced by Cleveland Clinic, Ohio.
Ma'am, I want to interrupt you for 1 second. I use this video in one of my trainings for nursing staffs and front office staffs at Kothari Medical Center back in 2016 as the introductory video to start the training session for on that class. That training was on soft skills, and I used the video, so I remember it very well. There is a nice sound to it, but the sound was somehow not audible. Anyway, thanks a lot, ma'am.
I was fortunate enough to visit Cleveland Clinic and I have walked this corridor actually, which we saw in the end. I have attended their annual summit in 2019. I was invited to attend their annual summit, and when I walked through that corridor, I literally had tears because I knew this is where the whole video has been, videographed. But I think this video, every time I see, I experience goosebumps. I can sense that everybody's going through some.
Yeah, it's a very, very, and that is nice to hear, and it's really a very heart-wrenching video. Yeah.
So I think this is the message I want to give, that one of the skills we have to have is empathy. So it is not for the patient. The idea is when you practice empathy, it's not just emotionally attaching yourself with the patient, but empathy helps you to quickly take a decision what you can do to relieve the patient's suffering. If a patient comes with pain, rather than getting annoyed or unhappy or being rude with the patient, I would immediately know that this patient requires this intervention and I can reduce the suffering. So it is empathy in action, compassion, which plays a very big role. And this is what is missing a lot of time in our interaction with the patient. Especially in corporate sector, we do get to hear these comments from the patient party that everything is fine, but there's nobody who's connected with you. Nobody cares for you. Everything is being done. All care is being provided, but that human touch is missing. And I think we really need to understand the importance of that human. So this is skill 4. Skill 5 is assertive communication, but I'm not going to discuss today. We spent a lot of time in question answer. So for my next session, I will have to cut down the question answer session because we should be able to cover more. Maybe for every question, we will take only 2 answers and then we move on. Because when you raise your hand, I don't feel like saying no to you. I feel okay, if everybody wants to talk, why should I stop them? But then we miss on the timeline, which is not a good idea. I think the learning from this session should be for all of us that only 2 people will answer, and then that way I ask multiple questions that can go on. So skill number 5, which is assertive communication, is not covered, in the discussion. So when we start the next session, in initial 10-15 minutes, we'll cover that. And those of you who have not taken the questionnaire on assertive communication, please complete that questionnaire, communication style. All of you have done it? Anybody who is still to do?
Ma'am, 1 minute.
Yeah.
Ma'am, 1 minute. Skill 1 was building rapport, right?
Yeah.
skill 2 is
Attentive listening.
attentive listening, and skill 3 is body language.
No, body language was part of building rapport. How body language can enhance building
Attentive
rapport.
listening,
Third one is
then skill 3,
positive and helpful attitude.
positive and helpful attitude. Okay. Thank you, ma'am.
And number 4 is empathy.
Yeah, ma'am, I got it.
And 5 is assertive communication. So I'm sharing the link to the feedback form. I think before we close the session, Porvi, I think you have something to ask. Go ahead, please.
Ma'am, is there any way where we can ask our queries?
Usually in the next session, I keep 10-15 minutes, initially to have the discussion. If you want, we can have it at that time, but I can spend 5 minutes if everybody agrees to answer your questions, because I know your questions must be fresh now, and we can spend 5 minutes. There's no problem.
Ma'am, thank you. I would like to ask one query. In recent years, I've noticed that patients, especially on telemedicine platforms, are themselves in a hurry to complete the consultations. They do not tell their name, their age. They directly start with their symptoms and come with a diagnosis that they have themselves made after surfing the internet. Some directly upload their medical reports and ask the consulting doctor to interpret them directly without giving any idea about what is going on with their health. Under such circumstances, despite the doctor's willingness to build a rapport with the patient, effective communication cannot be achieved. How do we handle such circumstances?
So one is clearly because now that's the trend they see, not with you, but generally with other doctors also, that straight away doctors and other healthcare providers also straight away start talking about the condition without building rapport. I don't know how many of us really make an effort to build rapport. So they are so used to that interaction. And also there's a possibility that they feel that the doctor's time is very precious. So let me not waste the time and let me straight away start with the problem, and so that I can get an answer to it. But if I know the importance of building rapport and I'm willing to invest that much of time, it would take a second to let the patient know that I'm ready to help you, but let me ask you a couple of questions. I need to know about your name, age, what do you do? Then maybe I would like to know about your problem, and then let's discuss. So you will have to really change their way of, communication by showing the right way of communication. And I hear it very often that patients would come and say कि मुझे अल्ट्रासाउंड लिख दीजिए, या मुझे ये फलानी दवाई लिख दीजिए, या मुझे मेरी ये टेस्ट हो गए हैं, मुझे इसकी रिपोर्ट बता दो. Again, because they don't expect us to spend time in discussing other things. So they think that maybe even you would want to just finish off the consultation in the shortest time. What if you said that I would do that, but let me first know what is the problem? What if I write the wrong medicine? So tell me about your problem. Let me understand your problem, and then let's think of what will work for you. So you will have to reverse the cycle, and of course this we can take as a role play situation in
One
the
observation, regarding.
Dr. Satya, 1 second. Let me complete. Then you come in. Give me 1 second. So in one of these session, Parvi, I request you to bring this situation. You be the patient and I will be Parvi, and then we kind of do a role play. How do you handle? And you can be as aggressive, as misbehaved as you want, so that we learn how to handle those situations. This program is going to be all role plays and actions. So we will have hands-on and we will get to learn from that. Just theory will not help. Just theory.
Thank you, ma'am.
Thank you. Yes, Dr. Satya, please go ahead.
I have one observation regarding telemedicine. Actually, I handled a very big project of telemedicine in Madhya Pradesh, and there were around per day there were around 6,000 to 7,000 consultations, running around 550 primary health centers. So that was a big sum. And what we found out that processes sometimes simplify the things. Number one is that in most telemedicine platforms, the patient symptoms, whatever the patient is suffering from, their reports and summary of their reports are uploaded by healthcare workers first for view of the doctor, and the doctor roughly gets about 70 to 80% of the cases, because most are acute cases epidemiologically, and very few are chronic cases. And regarding acute cases, mostly the symptomatology and the reports do mean a lot. And I think the communication on telemedicine platforms have its inherent defects, because there is no personal contact, there is no eye contact, there is no non-verbal communication, there is no rapport building, and the time is exceedingly short. You have a limited time of 3 minutes or 5 minutes maybe, and you cannot extend that because that is system made. So I think we have to be. There are certain pros and cons of using any platform, technological platform, and sometimes, of course, what Madam told, it is very important that nowadays patients do come with their diagnosis and all. They know everything, and you have to be a mute spectator, and maybe you have to write whatever they've asked you to write. But on the flip side, I would say that still these patients are few. Luckily for us, even in ground level physical contact situations in hospitals, we are encountering this kind of patients who are all knowledgeable and who think that doctors are there, know nothing.
Can I interrupt you? Satya, can I interrupt you?
Ah.
Yeah. See, these challenges in communication, especially handling different kind of patients, we are going to discuss at length in the coming session. Patients who are
Surely.
have a lot of complaints, or patients who are very aggressive, or they don't comply. We will be doing role plays around it in almost every session. Yeah. So I think there will be hands-on. We will be discussing. At the same time, I think, Parvi, if you have brought in this issue of telemedicine, I will not say that because there is no time, so we can't talk about that. I will say, remember to bring this as one of the situation in one of the role plays, and we will do a role play around it so that you get to learn whatever your learning objective is from the program. Because my idea is that I should be able to meet your expectation, and we will do it. But Dr. Satya, thank you so much for bringing that in, because if you have had some experience, I'm sure. And Parvi, you could also get in touch with Dr. Satya maybe to learn from him directly, because if he's into telemedicine or he has done telemedicine project, so you can always speak to him and get more input from him. Dr. Manjusha, I think you wish to say something. Please go ahead.
Madam, it's just a request. Something that I find I have a problem with is keeping my communication crisp and to the point. I sometimes overshoot my time and always get criticized for the same. So in any of your sessions, if you could just give me probably some tips and tricks to how to keep your communication.
Definitely. Please remember, when it comes to delivering a session, I will be taking two sessions on how do you design a program and how do you deliver a session. In that we can cover, and do bring that up, and we will talk about that. So I've shared the feedback form in the comment section. I request all of you to complete the feedback, and if you want, I can even share in the group, so that in the WhatsApp group, so that if anybody has not done it, you can complete this. So please make sure that you give your feedback every time, so that in case if there is something that you want to change or not okay, we can incorporate those changes or your suggestions in the.
Sure, ma'am. Thank you.
So we'll close the session here. I'm sorry, we are 15 minutes almost. If you all join at least 5 to 7 minutes before 8 o'clock, then 8 o'clock sharp we can start. And from next time onward, we will, I know, I really appreciate the enthusiasm all of you are, showcasing and answering the question. So we will have 2 answers for every question so that each one of you know that if 2 people have answered, then I have to try next time and let everybody, take an opportunity to answer. So thank you so much. It
Thank
was
you, ma'am.
wonderful with all of you. Thank you. God bless you.
Thank you, ma'am.
Bye-bye.
Thank you, ma'am.
Thank you.
Good night.
I will share the recording very soon.